As a result of healthcare reforms, more people have access to insurance, but affordable care is another question, especially if you're faced with high bills for outpatient visits and medications. Healthcare for All supports legislation to ease the burden by reducing copayments and possibly reducing the cost of care in hospitals. To tell us about the campaign is our guest from Healthcare for All, the Senior Health Policy Manager, Suzanne Curry. Thank you very much for being with us, Suzanne.
Thanks, Chris. Glad to be here.
To start with, we all know what copayments are, but put this on the trend line here. How much have they been going up?
Well, copayments and other forms of cost sharing, like deductibles that we know about, which is kind of all the costs that you have to pay before your insurance kick in, have been going up a lot in the past several years. There's been the last study that happened in the Massachusetts Health Reform Survey showed that although we have a great number of people who have access to insurance, the highest in the country, about 1 in 5 adults in the Commonwealth have trouble accessing services due to cost. So that could be a combination of factors, but they looked mostly at cost sharing like deductibles and copays. And so we know that this is a trend and it's going to continue to happen, especially as the Commonwealth and other employers are trying to keep premiums down. Cost sharing tends to increase.
Well, I'm sure many people complain about this. They watch their money, but in some cases it's not as easy as that. Tell me about some of the cases you've heard about.
Sure. So we have a toll-free helpline at Healthcare for All, and we do hear from consumers, and we also do some consumer organizing where we hear from people who are really struggling. They may have chronic conditions, more than one chronic condition perhaps, maybe diabetes and hypertension, and they need multiple medications to control these conditions over time. And so people with chronic illnesses and low-income people who may not be able to get help paying for their copays, it adds up for them, and it really takes a burden on their budget, and some people actually start rationing care that they really need and maybe end up with more acute hospitalizations and things like that could have been prevented if they had access to lower cost medications and treatments.
I saw some information about one patient. She was in hospital for quite a while, and that must have cost a bit.
Yeah, so we heard from one. We actually just had a hearing on the legislation that we are trying to pass to help ease this situation for people. And we heard from one woman who was actually in a coma for about 26 days years ago, and then coming out of the coma, she presented with a lot of different complicated problems: diabetes, hypertension, congestive heart failure. So she needed quite a bit of medication. She takes about 14 medications that she needs monthly, refilled, to keep her well and keep her out of the hospital. And at one point, she just really had a hard time keeping up with all those costs, and she ended up back in the hospital, which is more costly than if you treat the disease head on.
Now, this is something that I readily associate with people getting older, having more problems, but you've also heard from the Crittenden Women's Union, and they're not an elderly organization.
No. Yeah, so Crittenden Women's Union is one of the organizations that is supporting this legislation along with us, and they help get women and families out of poverty. They work with them, and one of the things they've been seeing is, we're helping getting people employed, and yet they're still struggling with their budgets, and part of that is due to healthcare costs. And we do see, younger people who do have diabetes, high cholesterol, things like that need to be, prevention is one key, but then once you have that chronic condition, how do you manage it and prevent larger conditions from appearing?
Or you might have a child with asthma.
You might have a child with asthma, exactly. That's another very good point there is asthma inhalers, they can add up as well, and you don't want someone to end up in the hospital just because of something that could be prevented if you have the appropriate medication to deal with it.
I'm sure the big question you must have also met up in the State House is, well, who's going to absorb the cost?
Right. Right, so one of the things that's interesting about this bill is we're not getting rid of copays and cost sharing overall for everything. We are targeting those medications and treatments that are high value. And what that means is that they provide a value to both the consumer and to the healthcare system overall. So we know that if you don't have access to your asthma medication and you have an attack, you may end up in the emergency room or in the hospital, which is a higher cost to both the consumer and the system in the long run. And so there's been numerous studies out there, and we've associated and talked with different health economists who have talked about this concept of, and I promise not to say it, but I'm going to say it a little bit, value-based insurance design, which does mean that you need to figure out, okay, what's going to keep people healthy and keep costs down for them and for the system, and you may potentially actually see savings down the line, or at least see it as cost neutral, because you're preventing bigger issues from happening.
The other issue I wonder about here is the medications, because we see these news stories about some companies, one way or another, just having a quasi-monopoly and just squeezing people dry. I mean, isn't there something more that has to be done about that too?
Yeah, I believe there is something more that has to be done about that. Healthcare for All also has other legislation that is different from this particular legislation that would increase transparency on the costs that drug companies have in creating medications, and then comparing that to what they actually charge for the medications in the market to see if there's some sort of anomaly there. Are they really charging something that's related to their manufacturing costs, or are they jumping up the price for no reason?
Is there any fear, though, that there might be, with a law like the one you're supporting, that some providers will be under pressure to maybe not prescribe as many medications, or because there's going to be some other cost-cutting pressure that's going to be coming into play here, isn't there?
Yeah, and so the healthcare system is an ecosystem. So sometimes when you cut costs one place, it might pop up in another place. Regarding the prescription drug transparency, we think, at this point, it's not saying you can or can't charge this amount. It's just kind of shining a light on how much you are actually charging, and hopefully putting a pressure on the industry to do right by consumers. And so we're hoping that it would actually ease the burden that providers feel and that consumers feel in prescribing some of these medications, because they'll increase their adherence. They'll increase their utilization of these medications, necessary medications. We're not talking about just anything for whatever reason, but for these medications that really help keep people well.
I know you make it sound there's a lot of medical logic behind this legislation, but is there any place where they've done something like this on some significant scale so that you can get the kind of savings and maybe the better outcomes that you're looking for?
So there's been studies, and it's mostly actually large companies that have experimented with this, and they have seen a lot of they might target particular medications for particular types of conditions. So there are some large employers that have done studies or have experimented with this, and they've seen reductions in hypertension, or say reductions in costs on the hospital side, even though increased usage on the medication side, but that ends up being either cost neutral or cost savings. And there's been some different studies done, and mostly with larger companies on that scale, and some with actual state employees. I think in Oregon is one of the examples.
Well, we should mention you have more details on your website, and you also have the hotline so people can call up with some of their problems.
Yes, so our website is www.hcfama.org, and our toll-free helpline is 1-800-272-4232, and we have counselors who speak English, Spanish, and Portuguese.
Thank you very much for being with us.
Thank you, Chris.
From Healthcare for All, Suzanne Curry.